My name is Lilly-West. I'm presenting this paper from Nigeria, and my topic for today is motivation and job satisfaction among hospital nurses working in Port-Harcourt, Rivers State, Nigeria. I'm a PhD student in the nursing department. This is the template I've been given to work with, so I'm going to start this way as an introduction. This study examined how motivated nurses working in Port-Harcourt metropolis of Nigeria are to their job and how satisfied they are with their jobs. The study examined the factors associated and to what extent what factor affected the overall score of job satisfaction and motivation. This was examined using a pre-tested questionnaire designed in two sections. The first section has to do with the social demographic section, which consists of age, gender, number, experience, educational qualifications, and all that. The second section really went into motivation and satisfaction, and some of the variables used were security of job, hours worked, recognition, advancement opportunities, support for training, independence, leadership style, their relationship with supervisors, relationship with physicians, physical condition of working, work overload, availability of tools, instruments like personal protective equipment. All these were some of the variables that were used. Now, the questionnaire was distributed to about 87 nurses who were part of the study. We used frequencies and percentages to describe categorical variables, and also used continuous variables were described using measures of central tendency. Statistical significance of difference between means was determined using analysis of variance, that's ANOVA. Regression analysis done using cumulative odds, ordinal logistic regression with proportional odds at 0.05. The results show that monthly income, that's salary, has tremendous effect on motivation and job satisfaction for the respondents, and that the overall level of job satisfaction is at 32.1%. All the individual components of job satisfaction correlate positively with the overall job satisfaction. However, working in the private sector could predict satisfaction for the nurses. My research problem. As we all know, employee motivation and job satisfaction is one of the single most important factors that determine work output in any organization, which applies to nurses, especially the fact that we make up 58.05% of the healthcare services providers in Nigeria. Its impact cannot be overlooked because it affects patient safety, staff morale, productivity, performance, quality of care, and commitment, organization, and profession. Like we all know, if employees are not motivated or satisfied with the job, patient safety will be compromised, staff morale will be low, productivity will be at its lowest, performance will not be optimized, quality of patient care will also suffer, and commitment, which is one of the greatest things that any organization can, will also be affected. Once your staff or employees are committed, that profession grows or that organization grows. The lack of motivation and job satisfaction has affected our health sector. However, there's paucity of data in this state where I work. There are other states in this country where this research work has been done. So we needed to find out what are the differences, or are they the same level of satisfaction in this state. Also, there's also no standard job satisfaction score or index that is universally endorsed by both WHO and any national health department. So the need for this study was critical, and I hope that my research tool will answer the questions. The methods used. I used Google and PubMed Central to do my search work. The literature ranged between 5 years and below. It was a non-probability sampling, but of a convenience type. We used it to look at the nurses who came for a mandatory continuous professional development. The reason was because people come from all over the state and even outside the state to do this program. And so it was a setting that will be able to catch everybody, both people from the private, public, and company. It's a qualitative study, but it was a cross-sectional study because it was just one-time research work. We just went in there and took our sample. Results and discussion. Majority of the respondents were female, as we know nursing to be, 96.6%, and they were between less than 45 years old, about 77%. The mean age was 39.37. 72%, 72.8% were married, all of them Christians. As you can see, the distribution of the age. The average number of years among all the people, these 87 nurses, was 15.7 years of qualification. They have worked for about 15.72 years. That's just a description of what it is. Results and discussion continues. Overall, a high percentage of about 48.36% of the respondents were neither satisfied nor dissatisfied with their job. Others were satisfied, about 28.7%. Dissatisfied were 19.5%, or those who were very satisfied were just a minimum of 3.4%. There was a positive correlation between all the components of job satisfaction and the overall job satisfaction. On multiple regression analysis, the odds of respondents working in the private was 0.207 times that of workers in other institutions. What this means is that from the study, we found out that yes, salary was a problem, but the people who worked in the private sector were much more satisfied than those who worked in the public sector. Analyzing it again, we found out that those who work in the private sector had two groups, those who work for private institutions and those who work for companies. The people who work for companies were more satisfied than those who work for private institutions. Although other studies in Nigeria have shown very high levels of overall job satisfaction among nurses, this study here found the level of satisfaction to be just 32.1%. This is possibly because of the high cost of living in the study location, and it has been shown in earlier studies that remuneration and cost of living is most associated with motivation and job satisfaction. The reasons being that you cannot earn a salary and your salary cannot take you home. So the metropolis where I live has a lot of inflation rates. You have twice the price of everything. So even if they earn a good salary, is not enough. And so that also made their motivation and satisfaction not to be. These are some of the references that I used. In conclusion, the level of motivation and job satisfaction among the nurses interviewed by the questionnaire is low as compared to other studies. The government and relevant authorities should look into ensuring that all the factors associated with job motivation and satisfaction among the nurses be looked into and optimized so as to prevent nurses leaving their profession or worse, traveling out of the country in search of better opportunities. I would also like to say that yes, nurses are the heart of any health institution, and so it should not be toyed with. My future steps. Motivation and job satisfaction among hospital nurses working in Rivers State. This will be a bigger study because this study just looked at the metropolis, the people who live in the capital city. But if we go to the rural areas, I think it will give us a broader picture of what the satisfaction level will be. The relevant authorities should not take with levity the perception of nurses or their level of motivation and job satisfaction. I would like to stop here and say thank you so much for giving me this opportunity. I think it's one of the best things that has happened to me. Thank you very much.